We are ready.
Thank you. Thank you, Arogyam UK, for letting me speak on this such an important topic, menopause, which was people were not very aware. It was a very less known topic and not taken care of. Rather, in olden days, it was that women were just kept names that probably she's aging and that she's lost her mind, and now this is the way you have to live. But that's not the right way. There are places where you can get help. There are menopause experts who can help you with all these issues. So it's important to know what the changes are during menopause. So today we'll be doing a presentation on menopause. Let's delve into the depth of the topic. I'll be sharing the screen now and we'll start the presentation. A complete guide on menopause and its holistic approach. I'm sorry for the spelling mistake over there. So what is menopause? Menopause is a time of change and it can be positive one. So you don't have to take it, oh, it's menopause, so now everything is going to be low and down. No, you can bring yourself up even in that phase of time. You need to know what choices are available to you to be able to make an informed decision. You can start your journey if you are or you are not on HRT. You must know that there are natural ways to help you through this stage of life. Menopause is a significant transition from a person's reproductive to a non-reproductive stage. Many people go through this change in their 40s or maybe earlier. I have had patients who've started these changes in 35 itself. So while others experience it later in life. Those born with ovaries are born with all of their eggs, around 2 to 4 million of them. These eggs starts to deplete from puberty onwards through menstrual cycles. Once the eggs are depleted, the hormonal feedback loop of the menstrual cycle is disrupted until it eventually ceases. Once all the eggs are over and there are no menses, only then proper menopause sets in. Perimenopause, menopause, and postmenopause. The complete cessation of menstrual cycle can take considerable amount of time, often up to 15 years. The term perimenopause or perimenopausal is used to describe the transitional phase leading up to the event when periods finally stop. Menopause is officially recognized after 12 consecutive months without bleeding. Subsequently, it is referred to as the postmenopausal period for the remainder of a person's life. What is the role of estrogen? Now let's speak something about the hormones and let's know what these hormones do. The role of estrogen. Estrogen can interact with receptors present in various cells throughout our bodies. Each cell's response to estrogen is determined by genetic factors, influencing how the cell functions. Here are some examples of what estrogen does in our systems. It promotes tissue growth and development, including the breast tissue, supports reproductive processes such as uterine growth and production of uterine lining, supports reproductive processes, plays an important role in regulating menstrual cycle, contributes to health and lubrication of the vaginal tissues, influences metabolism, very important function, fat distribution and the storage of fat in the body. It supports the growth and maintenance of skin, bones, tissues throughout the body, including cellular repair. Maintains healthy blood cells and promotes optimal lipid levels. It assists in fluid and electrolyte balance, works in conjunction with other hormones to influence sexual desire and function. It interacts with other chemicals to support brain function. So that is the role of estrogen, a very important hormone in a woman's reproductive life. What is progesterone? Progesterone, often referred to as the pregnancy hormone, plays various roles in our body. It influences cervical and vaginal mucus, facilitating sperm movement, relaxes uterine muscle to prevent cramping, counteracts the effect of estrogen on the thickening of the womb lining, creating an environment conducive to potential fertilization, implantation, and fetal growth. Progesterone is primarily produced by the corpus luteum, which forms from the empty follicle where the egg develops. However, the activity of corpus luteum is temporary and it eventually deteriorates or disintegrates rather. To support a pregnancy, the body requires additional hormones such as human chorionic gonadotropin, that is HCG, produced by the placenta to signal the brain of a pregnant state and to maintain the production of hormones necessary for pregnancy. If fertilization does not occur, progesterone production declines, leading to shedding of the womb lining, and the pituitary gland initiates the menstrual cycle once again. The role of testosterone, a very less known hormone. Usually it's considered that estrogen, progesterone are the only female hormones, but testosterone has an important role in female bodies as well. It plays vital roles in our bodies, including maintaining energy levels and mood, regulating bone physiology, influencing muscle mass, supporting cognitive function, contributing to normal metabolic regulation, playing a role in dopamine production, which can impact sexual desire and orgasm. Symptoms of menopause. There are more than 100 symptoms of menopause, but we'll speak about the commonest symptoms. The first symptom which signalizes menopause or perimenopause is irregular periods. The average age that a person's last period happens is 51. But 8 out of 10 women suffer from irregular periods throughout perimenopause. Periods can be irregular and often heavier or lighter. The consistency and the frequency of periods tends to change. It could be more often, they could be less often, it could be heavy bleeding, it could be scanty bleeding. It differs from person to person. It is due to levels of estrogen and progesterone that regulate the menstrual cycle, fluctuating like mad. It even can mean that you can have a menstrual cycle with no period. Hot flushes. The most commonly known menopause symptoms are hot flushes, and it is the number one reported symptom of menopause, with 75% of women suffering from hot flushes. They are caused by hormone levels restricting our body's ability to regulate temperature. Being sweaty and red when you don't want to be, it's a huge issue for many women though particularly at work. I had a school teacher today, and she is teaching sports to the children. She's their PE teacher. She's going through menopause and she has hot flushes and sweats, and she has to play and she has to be active with the kids. She's finding it so difficult. We just saw her today, and hopefully she'll be in a better place now after the medicines. Night sweats. Hot flushes at night can cause night sweats, making the symptom the second most reported issue in menopause. Tiredness and fatigue. Perimenopause can be signified by feeling flat or down or low. It's extremely common to feel exhausted as your hormonal levels change. Bloating and water retention. One more so many times this is the symptom which will signalize perimenopause. Women start getting bloated. Swollen tummies are common during menopause as hormone changes lead to our bodies to store more water in our extremities, causing puffiness. Vaginal dryness. Vaginal dryness is the fourth most common menopause symptom. So while it may be embarrassing, it's nothing to be ashamed of. It is caused by a lack of estrogen. Lubricants can help, and talking openly about the issue and seeking help from your doctor is the key. You don't need to have an unhappy sex life. Acne. It's estimated that quarter of women in their 40s and 15% of women aged 50 or older suffer from skin problems. So just like during puberty, the hormonal fluctuations are to be blamed. Change in skin texture. Studies show that women's skin loses about 30% of its collagen during the first 5 years of menopause. After that, the decline is more gradual, with 2% sloping off every year for the next 20 years. This will result skin becoming more drier, and you will notice more lines, less firmness, and skin around your jawline, cheeks, and neck. And again, there's low libido. This is one of the commonest symptoms which is reported by women. And this usually happens due to low testosterone, estrogen levels. And it can be helped with using supplements, using natural herbal remedies or homeopathic remedies. It can definitely be helped with. Mood swings, sometimes called the meno rage. Mood swings can be a huge part of menopause. It can lead to women feeling a huge amount of guilt, but it is driven by our hormones. It's like being a teenager in the reverse, because there are similar kind of hormonal fluctuations during teenage as well. Depression. Following on the above, the menopausal changes to our body can lead to a low mood. Researchers have also found that women entering the menopause can be more prone to seeing increase in the level of a brain protein called monoamine oxidase A, which is linked to depression. Mild exercise and a healthy diet play a part in helping to prevent low mood. Seeking professional help is recommended if your depression is prolonged and severe. Headaches. Migraines can be crippling in menopause, as hormone headaches are very real. Stay hydrated and take time out of stressful situations when you need it. Ask for help. Don't suffer in silence. It's really important that you address your symptoms and seek help. Weight gain. It can be hard to lose weight in your 40s or 50s due to change in hormone balance. Diet and exercise are the key, but also be kind to yourself. Your weight doesn't dictate your worth. The weight basically in menopause is to compromise the function of the ovaries. The ovaries usually produce estrogen and progesterone. And when the estrogen and progesterone produced by the ovary starts declining, there is little tiny amount of estrogen which is produced by the fat cells and the adrenals. So the body responds in a way by increasing the fat cells so that the body gets enough estrogen. It is a kind of reflex action. The weight gain during menopause is a reflex action to the low estrogen levels. And the other symptom which is reported is sore and tender breasts. Changing hormones can lead to sore and tender breasts, just like when you are on your period. Burning mouth or dryness of mouth. Many women complain of burning mouth or dryness in the mouth. It is a lesser known symptom but awful side effect of menopause. Avoid spicy food and try to get creamy, cooling foods and drinks to help. And of course, supplements also help in such cases. Bone and teeth strength. Your whole body, including your mouth, gets drier as your estrogen levels drop. Bacteria love breeding in the parched environment, which can result in tooth decay and bleeding or receding gums. Dizziness. Some research has suggested that the hormones which play a part in balancing our blood sugar levels fluctuate during perimenopause, affecting the body's response to insulin, which can in turn lead to dizziness. Bladder weakness. Low estrogen is responsible for this. Regular trips to the loo aren't common, and you don't need to be ashamed of this. Again, it is worth cutting down on caffeine and carbonated drinks, as they can irritate the bladder. They are known diuretics, as you know. Thinning of hair. A decline in progesterone and estrogen causes hair follicles to loosen. It can be a huge issue, but modern shampoos, diet, and HRT and other allied medical help can help with all these symptoms. Trouble concentrating. Estrogen in particular encourages blood flow to the brain. So if there is not enough of it, it's unlikely that you'll be able to focus your best. If you're also having trouble sleeping, this will impact your ability to concentrate. Loss of confidence. Amongst the many symptoms of menopause, loss of confidence is one of the symptoms, and trouble concentrating, lack of sleep, all these, and your weight, all these can contribute towards loss of confidence. But changes to your family situation, life events, relationship, and work may also have an impact. Muscle tension. Muscle aches are caused by changes in the levels of estrogen and progesterone. Progesterone has a calming effect on the body and mind. And when it dips, everything gets tenser. Then all these things go hand in hand, and you start feeling more anxious. Anxiety is also, again, one of the symptoms of menopause, and panic attacks as well. When estrogen level drops, cortisol levels rise, which result in higher levels of stress. And this can also raise blood pressure and blood sugar, all of which can cause muscle tension and hence the aches and pains. Recurrent UTIs. Hormonal changes can thin the lining of urethra, the tube that takes urine from the bladder to the out of your body, making it more prone to infection. Panic disorders, as we discussed about anxiety. Anxiety can lead to panic disorders. Again, changing or imbalanced hormones are to be blamed. Estrogen and progesterone usually work together to regulate mood. As they drop or fluctuate during midlife, women are at more risk of developing anxiety. The anxiety can be overwhelming and can result in panic attacks. Sagging breasts. Before you go from menopause from perimenopause to the menopause, your estrogen levels drop dramatically. This causes your reproductive systems, including your ability to produce milk, to start to shut down, which shrinks the glandular tissue in your breasts. And hence the breasts lose the substance and they start sagging. This change, combined with depleting collagen production due to aging process or due to lack of estrogen, again can cause the breast to sag. Worsening PMS. The fluctuation of progesterone can lead to experiencing an intensified version of their average premenstrual symptoms. I have seen ladies who had severe PMS when they were teenagers, and then went into their reproductive life, they were fine. They did not suffer much from PMS. But again, when they come into the perimenopausal time, they again start suffering from the PMS. So PMS is also common amongst women of perimenopausal age who were fine during the reproductive age. Dry eyes. As I said previously about the dry mouth, there can be dry eyes as well. It's unusual, but not that common, but it is known to happen. And unable to control its water level go easy because the body is not able to control the water level. Dry mouth. This can alter your sense of taste, appetite, and cause burning mouth syndrome. It can also cause you to have sore throat and lips, leaving you feeling more thirsty than usual and make you hoarse. It is important to stay hydrated and to use a lip balm to avoid lip soreness. Tingling extremities. Low estrogen levels cause skin to thin a little and reduce the blood circulation to the nerve endings in your extremities. It is uncomfortable, but has no larger significance. It's just that women do complain of tingling in the extremities, and the cause is unknown. In spite of giving all supplements, they still complain of tingling. And that's probably because of the lack of blood supply to the nerve endings in the extremities. Brain fog. This is one of the commonest and largely seen symptom, which is affecting the menopause group intensely at workplaces, home, in relationships, everywhere. Again, caused by estrogen levels, which help get blood flow to the brain and improve concentration. When there is lack, our memory is affected and our ability to focus is affected, and hence brain fog. So for this, you need to stay well hydrated, sleep well. You must reach out for help if you're suffering from these symptoms. Lapses in memory, as well as aging more generally, hormonal changes during the menopause can cause us sometimes to be more forgetful. Research has shown this to be true with perimenopause affecting our cognition as well. Keep your diet and sleeping in check. Consider incorporating some mental exercises to strengthen cognitive function. Keep reading, do puzzles, keep yourself active, keep working. Joint pain. Estrogen affects your cartilage, which is the connective tissue in the joints, as well as bone turnover, the natural replacement of bone in your body. So it can play a part in inflammation and pain. So as we head into the perimenopause, fluctuating hormones can cause our joints to hold less water, which they need to work properly, which results in inflammation and pain. That's the reason I always advise my patients with joint pains to drink plenty of water, because dehydration adds to it. Lack of motivation. When progesterone, thyroid, and adrenal hormones fluctuate, your body isn't able to regulate its cellular energy, which can lead to lack of motivation and feeling fatigued. Because the energy does not reach the cellular level, and also insulin resistance at this stages is found to be more. So once you develop the insulin resistance, the cells don't get the required energy and they feel fatigue. There is craving for food along with feeling fatigue. Itchy skin. Decline in collagen levels due to estrogen can lead to feeling of itchy skin. Brittle nails. Just like with changes in hair texture, your nails become brittle, less lustrous, and less strong during menopause. Insomnia, again, one of the most common symptoms. Women disproportionately suffer with insomnia, and this only gets worse during menopause. Please don't have caffeinated drinks after lunchtime. Body odor. This is one more symptom, which is complained by women that they never had body odor during their reproductive life, but as they enter menopause, they have a bad body odor. Given your libido may be lower, it's quite unfair that hormonal changes can also lead to poor body odor, but unfortunately, it can definitely. Heart palpitations. Your body may surprise you with an irregular heartbeat, palpitations along with anxiety and heightened stress. You become edgy, you become irritable, you tend to stress out easily, where otherwise you were quite strong, but then when you reach this stage, you have these hormonal fluctuations. You tend to kind of be more irritable, more edgy, and don't find yourself to be strong or confident enough. Loss of bone density. The lack of estrogen, again, a hormone essential for healthy bones. We'll speak further about bones. It is a very important topic. And it can cause women's bones to weaken more rapidly in the first few years after their periods stop. This is a reason why it is important to continue to exercise during perimenopause for mobility and strength in midlife. Complementary therapies. For many people, especially hormone-sensitive cancer sufferers, HRT is not an option. For others, they can choose not to follow a chemical medical route to managing their health. You can go the natural way as well. So let's speak about some natural ways. How yoga supports menopause. It reduces stress and anxiety. Yoga focuses on breath and movement, and it helps calm the nervous system. It improves sleep. Regular yoga practice promotes relaxation and it leads to better sleep quality. It balances the hormones. Certain poses can stimulate the endocrine system, supporting hormonal balance. Enhanced emotional well-being. Yoga fosters self-compassion and emotional resilience. Incorporating yoga into daily life. Start small. Begin with a short practice of 10 to 15 minutes a day. Find what works for you. Explore different styles of yoga to find what feels best for your body. This is the reason why you need someone to guide you. Consistency is the key. Regular practice yields best results, even if it is just a few minutes each day. Listen to your body. Modify poses as needed and never rush yourself into discomfort. Yoga with pain or discomfort is a stress. It has to be mild, it has to be pain free, it has to be comfortable, it has to be relaxed, it has to have a calming effect on you. How yoga works. Physical benefits. It improves flexibility and balance. It strengthens the muscles and bones. It enhances circulation and cardiovascular health. Mental and emotional benefits. It reduces stress and anxiety, promotes relaxation and better sleep. It increases self-awareness and emotional stability, increases self-compassion. Holistic approach. Yoga addresses the body, mind, spirit, promoting overall well-being. The basic principles which you should follow for yoga are asanas, pranayama, and dhyana. All three are important. They have a different implication at different levels. Asanas are designed to align, strengthen, and promote flexibility in your body. Examples are downward dog, warrior pose, and child's pose. Pranayama, or the breathing techniques for controlling the breath, calming the mind, and energizing the body. Examples are Ujjayi breath, Nadi Shodhana, Dhyana, meditation, which is important again. It relaxes you, it calms you down. The practice of focused attention and mindfulness. Examples are guided meditation and mindfulness meditation. Mindfulness and menopause, a time of change and transition. The role of mindfulness in managing menopause symptoms is very important. Let's know what mindfulness is. Mindfulness is the practice of paying attention to the present moment without judgment. Benefits: it reduces stress and anxiety, enhances emotional regulation, improves sleep quality, increases self-compassion. It's important to have compassion for yourself during menopause. Don't let people judge you. Just be what you are. Proven mindfulness techniques. Mindful breathing. Focus on your breath to anchor yourself in the present moment. Loving kindness meditation. Cultivate compassion towards yourself and towards others. Body scan meditation. Bring awareness to different parts of your body, releasing tension. Just sit with your eyes closed. Think of your body parts. Start from the toes. Gradually think of the toes, how your toes are feeling. Gradually come upwards. You can feel different parts of the body and you can just relax. Give some time to yourself. Mindful walking. Engage fully in the experience of walking, noticing each step and breath. Nature walking is the best thing for mindfulness. How menopause affects gut health. Hormonal shifts, change in the estrogen levels can impact the gut flora. Digestive issues, increased risk of bloating, constipation, and other digestive discomforts. Also, this increases inflammation. Menopause can lead to higher levels of inflammation, affecting the gut health. So the importance of gut health food during menopause is probiotics and fermented foods, yogurts, kefir, sauerkraut, kimchi, and their role in supporting gut flora. It's important to incorporate these foods in your perimenopausal period or menopausal period. Prebiotic-rich foods, garlic, onion, asparagus, feeding the good bacteria, which is common in our Asian diets, but it is important to make sure that you have all these foods. Fiber for digestion, whole grains, fruits, vegetables, for promoting regularity and reducing inflammation. We have spoken in details about all these foods during the last webinar, which was on anti-inflammatory foods. Foods to avoid for better gut health. highly processed foods, which have negative impact on the gut bacteria and overall health. Highly processed foods, excessive sugars, artificial sweeteners, these are also known as depleting foods. Rather than being nourishing foods, these are depleting foods. They will deplete the antioxidants or the nutrients in your body. Excessive sugar, how sugar feeds harmful bacteria and contributes to inflammation. Artificial sweeteners, potential disruption of gut flora balance due to artificial sweeteners. So bone health is one of the important topics in menopause because there are many women who suffer from bone health, bone disorders. Once you cross the menopausal age, you are more prone to osteoporosis. What is osteoporosis? Osteoporosis is a condition where bones become weak and brittle, increasing the risk of fractures. Often called the silent disease because it shows no symptoms until a fracture occurs. Common fracture sites are hip, spine, and wrist. It affects 1 in 3 women over 50 years of age. What is osteopenia? Osteopenia is the stage before osteoporosis where bones are weaker than normal but not yet fragile. Often diagnosed through a DEXA scan, which measures the bone mineral density. Without intervention, osteopenia can progress to osteoporosis. The best way you can help to prevent osteopenia going to osteoporosis is strength training, calcium supplements, and vitamin D supplements. So it's important that you seek help. Why bone health matters in menopause? Estrogen levels drop significantly during menopause, which accelerates bone loss. Women can lose up to 20% of their bone density in the first 5 to 7 years post-menopause. Without intervention, this can lead to osteopenia or even osteoporosis. The silent threat of osteoporosis. Osteoporosis is often symptomless until a fracture occurs. Fractures can lead to reduced mobility, chronic pain, lot of dependence or loss of independence. Osteoporotic fractures are most common in the hip, spine, and wrist, as we previously discussed. The risk factors are family history of osteoporosis, early menopause before the age of 45, medical conditions like rheumatoid arthritis and thyroid disorders, where the calcium metabolism is also affected in thyroid disorders. Lifestyle-related risk, poor diet which is low in calcium and vitamin D, lack of weight-bearing exercise. So you need weight-bearing or strength training exercises. Smoking and excessive alcohol consumption can also lead to osteoporosis. The symptoms, how do you know that your bone is thinning? There will be loss of height over time. I was very surprised when I was a child. I remember my grandmother, and I knew that she was of a particular height. But then as she started aging, I used to ask my mom, why has she become shorter now? Because I did notice the difference. So it's a very slight loss, but you can make out loss of height over time. Back pain caused by fractured or collapsed vertebrae, stooped posture, bones that break more easily than expected. So these are the common symptoms where you can find out that the bones have started thinning. Prevention is better than cure. Aim for 1000 to 1200 mg of calcium daily. Weight-bearing activities like walking, jogging, and resistance training. Avoid smoking and limit alcohol intake. And this is one of the most important part of managing menopause is supplements. Supplements are beneficial during the menopause in order to ensure that you have adequate nutrients for maintaining healthy bones. Many of the following supplements are also known to help with the symptoms of menopause. A good quality multivitamin and mineral would form the foundation of your supplement program to make sure that you're getting a little bit of everything You can then add nutrients listed below in slightly higher amounts, which are known to be helpful, like vitamin C, vitamin E, B vitamins, omega 3 fatty acids, magnesium, calcium, and vitamin D. And now is the most important topic, or my passion, I should say, homeopathy. Homeopathy's core principle lies in recognizing the individuality of menopausal experiences. Detailed consultations enable us to understand nuances of symptoms, paving the way for personalized remedies that closely resonate with each woman's unique set of challenges. Like I've previously always told you, that homeopathy, we cannot just list the remedies, these are the remedies for menopause. We have to individualize, we have to take a detailed case history. Depending on that, we can reach a remedy. So, balancing hormones naturally, homeopathic remedies working in harmony with body's innate healing mechanisms target hormonal imbalances inherent in menopause. By gently supporting the body's adaptation to changing hormonal levels, these remedies alleviate symptoms like hot flushes, mood swings, sleep disturbances. Emotional and mental well-being. Menopause often brings emotional turbulence encompassing mood swings, anxiety, irritability. Homeopathy considers this emotional landscape, selecting remedies not just based on physical symptoms but also on individual emotional states. The holistic approach provides comprehensive support for the emotional aspects of menopause. Collaborative care. Homeopathy seamlessly integrates with the conventional treatments, offering a complementary approach to managing menopausal symptoms. This collaborative care empowers women to benefit from both the conventional medical interventions and the holistic support provided by homeopathy. So, now we'll speak of some common remedies used by homeopathy. One is sepia. Lots of symptoms, but the main physical characteristic is dragging down sensation. Everywhere she complains of dragging down. In the vagina, there's dragging down. In the anal region, there's dragging down. At the urethral level, she'll feel that dragging sensation. There are hot flushes which rise upwards with perspiration, and she feels easily chilled. Bearing down sensation in the pelvis, waking up to palpitations, irritable, mentally and physically worn out, may fear alienation from those closest to them, anxious and worry a lot, mood swings, heightened sensitivity to smell and touch, worse from staying still and feel great after exercise. Dry skin and heavy bleeding could be the symptoms for sepia. Lachesis. Intensity with internal pressure. There is an inner drive with nowhere for it to go. There's an inner drive, but they don't know what to do, where to go, what should I do. And they feel constricted in every area. If there's a headache, there will be constriction around the head. There will be constriction around the chest. If there's a tummy pain, the patient will complain constriction around the abdomen. So constriction is the commonest symptom. Hot flushes, panic attacks, palpitations, symptoms move from the left to the right. Predominantly a left-sided remedy. Moreover, the complaints are left-sided. Melancholic disposition, depression of menopause, and a feeling of hunger returns after eating. As soon as she finishes eating, there'll be more hunger, and mind runs faster than the tongue. Perceptive, very sensitive, and easily hurt. History of hurt leads to protecting with suspicion and are constantly on guard and can drain people around them. Submissive yoga. Alternation of physical and mental symptoms. Overwhelmed with gloom as if surrounded by a cloud, cold and icy. A lot of low back pain, worried about losing control, especially during the menopause. Bearing down sensation, hot flushes with a pale face, feel like constantly facing danger, Ailments from fright are easily frightened, depression with a sense of hopelessness, no light at the end of the tunnel kind of people. Such people can be helped with the remedy Semicifuga. Sulfur. Frequent flashes of heat during the day. This is one very common remedy for hot flushes. With hot head, hands are hot, feet hot, must throw the covers off, mild perspiration, fatigue, faintness, emptiness at the pit of the stomach. Dry, itching sensation, easily bored, persistent thoughts, sleeplessness. Worse morning 11 a.m. and at night. And worse standing. These sulfur type of people, they just can't stand. The moment they have some standing work, they'll just try and see where and when can I sit. They don't want to stand at all. Calcarea carb. Hot flushes and head sweats, mental or physical jaded states due to overwork, worry. These are family kind of females who want to do everything for everybody, but they will never care for themselves. Frequent waking at night, arthritis, stiffness of joints, or foot cramps since menopause. Thirst for cold drinks, worse ascending and worse milk, worse from pressure of clothes. Damp weather also aggravates such people. Sabina. Pulsating sensation and hot flushes during menopause. Hot flushes, worse clothing, want to take off clothing and fan themselves. Desires fresh air, irritable and ill-humored during menopause. History of being worn out and overworked. Weak uterus, varicose veins. Generally, this is a common remedy again for prolapse as well. Generally left-sided, desires juicy, sour things, lemonade. Worse at night, worse from physical contact, and desires tranquility. Folliculinum is one very important remedy, or rather I should say kind of hormone remedy, I should say. It affects the hormonal levels. It helps people with changes in the hormones. It helps during puberty, it helps for PMS, it helps for PCOD, it helps with infertility, it helps with menopause as well. So wherever there's a fluctuation in hormones, folliculinum is one of the most important remedies. A female remedy affecting the female hormonal system. Symptoms from ovulation to menses. Mood swings from aggression to apathy. Alternating excitability and depression. PMS symptoms, congestive headaches, hot flushes, night sweats, dizziness, recurring cystitis. Better movement. Patient feels better by movement, better with fresh air, and they are intolerant of noise, touch, or heat. Sanguinaria. Sanguinaria is another remedy for heavy menses or clotting in heavy menses during periods, during the menopause. Flushing, red cheeks, burning sensation, burning palms and soles. Right-sided remedy. Headaches ascending from occiput to over the right eye. Headache is going, especially when going without food. These people crave spices, they are lethargic, averse to work, do not want to work, want to sit idle, worse from wet weather, from odors, from noise, oversensitive, soreness, down muscles of back, pain and stiffness in the right shoulder, unquenchable thirst, aversion to butter, worse 3 a.m., worse periodically, and there are characteristic burning pains. Gelsemium, hot flushes alternating with chills up and down the spine, sweats from slight exertion, night sweats, apathy and depression, state of stillness, muscular weakness causing aching, heaviness and soreness, heavy droopy eyelids, very sleepy person with a very torpid liver, or liver not functioning very well. So they are really fatigued, lethargic, droopy, and always heavy headaches kind of people. flushed face, extreme exhaustion, desire to be alone, low appetite and thirst, emotional excitement, overpowering fear, anxiety about future, deep-seated aching in the bones and joints, insomnia from mental excitement and from exhaustion. Then is the remedy Pulsatilla, which is one of the commonest remedies again used during menopause. This is for women who have a real weeping tendency. They will start crying at every drop of the hat and they want to be comforted all the while. Flushes of heat, sweats at night and in the morning, craves fresh air and likes to go outside, restless and have to move to readjust. They will never sit still. If you see a patient come in the clinic and they will just keep moving all the time, they will not sit still. That is one of the signs and symptoms for prescribing Pulsatilla. Worse for stuffy rooms, from stuffy rooms or cigarettes, worse from rich food, fatty food, thirstless patients, changing, shifting symptoms, useful from puberty to menopause. This is again one of the very important hormonal remedies. So just to let you all know that I have completed my menopause expert certificate. So now I'm a proud licensed menopause champion and business partner. So Faith Homeopathy Clinic is now a menopause recognized clinic. So if you need to book a pre-consultation with me, you can please feel free to go to my website and book a free pre-consultation. And it will be a 15-minute discovery call. And this is the Faith Fitness program, which is a 3-in-1 online program for long-term health. We usually advise patients for this program, especially during menopausal, perimenopausal and menopausal period, because we have nutritional guidance in this, we have exercise and homeopathic remedies as well. So it's a 3-in-1 online program. If you want to contact us, please feel free to contact us on this number. This is my email address and the website. Thank you very much for listening. Thank you for your attention.